I remember about 2 years ago, I got one of my gyms. I own two gyms. One is in Denville, one is in Randolph. By the way, just for the record, I'm a low back disorder certified specialist too, and a kinesiologist. So I work with people with a lot of injuries. I remember 3 years ago, I got these three guys from Monmouth University that came injured. They have one was a wide receiver. He got a back hip. The other one was a safety. He got a back shoulder, and I think the other one, he was a lineman. He got a bad knee. And those guys were really wrecked. It was Division I football players, and they were really in great shape. So one of the things that I noticed was that they have a six pack and everything, and I noticed that their core was very weak. And a lot of people tend to misunderstand the concept of what core is really all about. A lot of people think that having a strong core, it means that people with six packs and totally ripped in their abdomen, and it's not. So these three kids came and have a lot of problems with their core functionality. So one of the things that I want to start telling you is that the core is, there are a group of muscles that extend beyond your abdomen. Your arms, your legs, your hip, your glutes, it's all part of your core. And how you're going to strengthen your core, it really depends on what kind of program you do, but it doesn't have to do just necessarily your anterior side of the stomach, which is the abdomen. So I was researching online, and I found that Duke University found that patients suffering from back pain consume more than $90 billion a year in treatments. It's horrendous. So more people are injured and basically overweight more than ever before in human history. Yet more people are in great shape and work up until they are 90 years old more than ever before in human history. And it's how you treat your body and what you do for your body to be fit and functional. That's basically what we're going to talk about today. So one of the things that I wanted to ask you first, who knows what core is? Like, you guys want to interact a little bit. What do you think about when you hear the word core?
Your center.
Part of it, yeah.
Abdominal.
Abdominal, yeah. Hip rotators, hip flexors, gluteus maximus, minimus, midsection, obliques, everything. Everything basically that's glued to your legs, knees has to do with the core. So one of the big problems that I see a lot of times when people come to me for injuries is that they have a very weak core. They have a lot of problems with hip injuries and knee injuries and stuff. And one of the things that we do is try to prevent things and sometimes try to reverse things by putting things together in a way where people start engaging their three main types of nervous systems. Okay, and there's three types. So we're going to try to engage that into exercises, or try to dictate or prescribe the right exercises that will involve in the three basic nervous systems. One is peripheral, the other one is in the brain, and the other one is called autonomic nervous system, which is basically has two branches. One is called sympathetic, which is the flight to fight nervous system, and the other one it's called somatic, which is more to digest and rest. So these three types of nervous systems I'm trying to engage in: the central nervous system, peripheral nervous system, and the autonomic nervous system. So let's try to see what we could do here to engage the three nervous systems and get in better health and also strengthen your core. Let's start with how your body works. The central nervous system basically gets afferent information from the joint receptors to your brain, and then from the brain to your joint. So that information gets transferred through your joint receptors. Your joints have different types of receptors that are called, they're different names. Thermoreceptors that respond to pain, mechanoreceptors that respond to balance, nociceptors that respond to touch. So all those receptors are stimulated basically with different tools. And once you get your body's receptors stimulated, you're gonna be able to prevent injuries, you're gonna be able to strengthen your core, and you're gonna be able to move better, function better. I remember one couple months ago, I had this lady that came with a back hip, and she needed to lose basically about 100 pounds. I mean, you see my testimonials on my flyers on the table. A lot of these people, it's not just the fact that come overweight and they need to lose the weight. They come injured and they have a lot of issues that need to be addressed. So this lady came, and one of the things I noticed was that the hip flexor and rotator was very tight. She was limping. Obviously, the first thing that I told her was you need to lose weight in order for you to get back into good health and be able to do all the drills that I'm going to prescribe for you to lose weight, aside from the diet and everything we did. So we start strengthening the hip area. We start stretching the glutes and the whole femur area, and she got much better in no time. One of the things that I told her was that training in a way that your body moves, like functional training, how your body moves unilaterally rather than bilaterally, is so essential for her to get in good health. A lot of people tend to go into these machines where start pulling or start squatting or leg extending. One of the things that I told Marie, I remember well what we discussed, is that start training your body in one single leg, in one single arm, because that's basically how we move. You want to reach out to something here, it's going to be on one leg. You never reach out to things in one arm. No, you never reach out to things in two arms. So we constantly engaging our core one way or the other because it's all connected. We walk on one leg unilaterally, not bilaterally. We get out of the car on one leg, not in two legs. So one of the things that I did with Maria was training her basically using something called functional training, which a lot of you know. Functional training is basically training the body in the way it moves. So one of the things that we did, we started strengthening her body on different planes of motion by using basically unilateral movements. So in no time, she got much better using stretching and all the therapy techniques. She got in much better health. And that's one of the things that I always recommend to people when they come to my shop. Start training your body the way we normally move. Use functional training for everything. Another thing that I noticed is that a lot of people tend to use benches or like stiff surfaces to start lifting weights or stiff platforms. So what I normally tell people is use things that will engage your core, that will challenge your balance and stability systems. So don't go into things that they're gonna basically stiffen up your back or just cause more problems. So when you sit on a ball like this, you basically are aware of your posture. That's called active sitting. Active sitting normally helps you to strengthen your core, to work on your legs. It basically works on your neck. It uses your main nervous system. So you're basically active. You're reacting. It's a great way to train. I tell people once you sit on this, you basically see a difference in terms of how your posture changes. Now, when you add in exercises to it, like many of you know, bicep curls, marching up, twisting, laying on the ball, you're basically burning more calories. So one of the things that I recommend is use the ball to get more active and also engage your nervous systems and basically get in good health. Now, one of the problems that I see a lot in people when they come and see me is that the algorithm of the body when it comes to injuries is basically overlooked. Sometimes doctors just look at symptoms and not causes. And when people come to me, they're like, well, I have a problem on my mid back, I have a problem on my neck. How many times a day you basically strengthen your jaw muscles? Well, never. How many times a day you strengthen your feet? How many times do you strengthen your fingers? I mean, there's basic things that are all connected that will help you to get in better health once you learn how to do it. And today we're going to discuss that. So I basically have a rule when I see somebody and I'm doing a whole assessment. The foot is very important. It tells me everything. How someone walks is basically, it's going to tell me exactly where I need to go with the training. The SI joint, who knows what the SI joint is? It's a cradle joint. It basically runs from here to here. Okay, a lot of people tend to have tiltness on the lower back, anteriorly or posteriorly. So once I see exactly how they walk and how the foot is positioned, I know exactly what I have to do. And the other thing, the cervical spine. How many of you know about the cervical spine? It's how the neck is positioned. The neck transfer a tremendous amount of information to your spinal cord. Afferently going up to your brain, and efferently from the brain to your joints. So all those three things are connected. And I normally tell people, so you have to really pay attention to those three things, because that's how your body's gonna improve. And dictating exercises to improve those three things, they're so fundamental, and unfortunately, very few trainers and physical therapists do that. So having somebody or seeing somebody the way it stands anteriorly and posteriorly will help me to get things basically under control. So what I do, let's start with the feet. The feet, it's so important. It has a lot of muscles and little joints that basically transfer information up to your body. So phalanges and metacarpals that basically just give information to your body in terms of how to position. So what I do normally is I recommend people to strengthen their feet by opening and close their toes. So about 1 minute, just like this. You see a lot of you are going to have problems doing it. It's not the same as doing this with your fingers. And then crunching, okay, for about a minute. You see a tremendous amount of difference in no time when you do that. By the way you walk, by half, the low back pain gets minimized and your overall posture. Try that every day. I really recommend that. Put a golf ball underneath your foot, okay, and massage your foot like this, up and down for about a minute, and then circle it. So you get all the calcaneus nerves on the foot that basically help you to, improve postural sway and all that. It's amazing because nobody does that. I mean, you go to see a physical therapist or trainer, one of the first things they're gonna do is like go on this machine and then just go around the circuit. So, and that's not basically what I do. When I have a client, I always try to look to basically the whole picture. Highest hip position, what the foot is telling me, the SI joint, the spiral of the body, the posture, and based on that, I start prescribing the exercises for them to start losing weight and improve their overall health. Now, the other thing I do, it's very interesting. I patented this machine actually a year ago. This is actually my invention. We went through the preliminary patent with this, and I use this to do a lot of stuff for the core. And remember, the whole body is basically the core: shoulders, feet, everything. And one of the things that I tell my clients to do with this is